I call Jan Logie.
Thank you, Mr. Speaker. It's with pleasure I take a short call for the Green Party on this bill that was previously one but has now been divided into 8, addressing the health practitioners' replacement of statutory references to medical practitioners bill. So firstly, I just want to acknowledge how important issues of health are to New Zealanders, and I think it's a kind of a no-brainer really that our health impacts on every single part of our life and is a foundation for our ability to participate and live fully. So, and we also need to recognise the changing circumstances and the health needs across the country in New Zealand. We have an ageing population, which of itself increases demands on our health system. We have, as has already been mentioned, an ageing health workforce, which we need to be very aware of and planning to prevent that impacting negatively on our systems. We've had significant advances in health technology, which has put a cost pressure on our health system. And we have a growing pressure on our health system from diseases that have been created as a result of poverty, of our sick homes that are putting people into hospital, and by the obesogenic environments that we all live in. So these are very, very significant pressures that should be addressed at point to prevent people needing to be pushed into our healthcare system. But some of these things, obviously, we can't prevent. We can't prevent ourselves ageing as much as some days I would like to. But this bill, so we know that we need to be thinking really creatively and forward-thinking about our health system. This bill is actually catching up with some of the changes, I would say, that has already been made within our health system. And I'll take nurse practitioners as an example. So since the 2000s, nurses, so registered nurses, have been able to become nurse practitioners, which means that they need to be registered with the Nursing Council, that they need to have had a minimum of 4 years experience in a specific area and of practice, and they need to have completed a clinically focused master's degree on top of their degree to become a registered nurse. And so with all of that training, those nurses have not been able to do some pretty basic functions. So this bill is helping us catch up to enable them to do what they are trained to do, which really does make sense in our system. And I would, I think it is useful to have a bit of a feminist analysis around this, that it has been a battle for this woman-dominated profession to be able to have recognition for the skills and be able to work at their level of competence. And the competence of nurses has always been undervalued in our health system. And I think it's really good that we are in some way catching up. But as has also already been mentioned, this can't be done to say that they can do the work that would otherwise cost the system more being done by a doctor for less money because they are nurses. That would be unjust, and that would feed into more of an equal pay problem, our pay equity issue, which we already have. So we need to be resolving those issues, and we do hope that the government is not going to exacerbate them in their actions following the passing of this legislation. And I would just also just again like to particularly note the importance of this in terms of rural health and specialist health areas where there are practitioners currently operating under guidance of a GP who will often come in on particular days where they're available to travel around to sign off, and they'll spend so much of their time signing things off that actually the practitioners had the competence and supervision to be able to make the decisions in the first place, and we are wasting their time, their precious time, signing things off when they could be face-to-face with people doing what is specific to their role. So In conclusion, the Green Party is very happy to join with all the other parties in this House in supporting this bill.